Good afternoon, everyone, and welcome to Iowa Ideas. This is our 9th year of Iowa Ideas, an event that explores topics that are important to Iowans. We are excited for a great 2 days of discussion on the pressing issues facing Iowans. The Gazette would like to give a special thank you to our presenting sponsor, ITC Midwest. Our sponsor support helps make the Iowa Ideas discussions free for all of you. You'll be able to submit questions to our panel today by entering them into the Q&A box or in the Zoom chat, and we will work them into our conversation today. And today we will be discussing what's being done to make farming safer while also addressing less obvious health challenges like mental health needs of farmers in Iowa. I'm Emily Hawk. I'm the special projects editor here at the Gazette, and today I'm joined by a lovely group of panelists. And I will go ahead and have each of you introduce yourselves, your affiliate organization, and then maybe just talk a little bit about what you do in that organization. So Renee, you are the lucky number one. You're the first person on my screen. So do you want to go ahead and introduce yourself?
Absolutely. Glad to be here. So I'm Renee Anthony. I am faculty at the University of Iowa, not Iowa State, which is everybody else I've been listening to today. I'm in the College of Public Health, and my background is in environmental engineering and this field called industrial hygiene. So my professional training and certification is in all things occupational health. So how do we protect workers from developing diseases from being exposed to a lifetime of things? And I started working with the Great Plains Center, which is funded by a CDC NIOSH funding back in 2011 on a manure gas and swine barn air improvement project. And now I've been here long enough that I direct the center and have great collaborations with researchers around the Midwest trying to solve important problems for farmers.
Awesome. Thank you, Renee. Rich, do you want to go next?
I sure can. Hi, my name is Rich Gassman. I'm the director of Iowa Center for Ag Safety and Health, also based at the University of Iowa. I will give a little shout out because I am an Iowa State alumni, so I gotta throw that in there. But mostly what we're doing is so we're in kind of a partnership between 4 different organizations, and our goal is to get information out to the farmers. One of the things we try to do is we call it meeting them where they're at. So trying to get out there and say hi and show them what resources we have available. So that's pretty much what we do.
Awesome. Thanks, Rich. David, do you want to go next?
Yeah, I'm David Brown. I'm with Iowa State University Extension and Outreach, and I am the Behavioral Health State Specialist, which means basically I manage all of ISO Extension's mental health, suicide prevention, education, and farm stress programming. I'm the PI for most of the Farm and Ranch Stress Assistance funds across Iowa from the USDA, and we've been providing stress assistance to farmers and farm advocates since about 2019.
Very good. Thanks, David. And Kanika.
Thank you, Emily, for having me here. My name is Kanika Arora. I'm an associate professor and faculty in the Department of Health Management and Policy at the College of Public Health, University of Iowa. I also work with Renee in the Great Plains Center for Agricultural Health. I support the program evaluation efforts. And I also, through support from that center, developed programs on farm families coping with dementia. And I've been working at the University of Iowa for the last 10 years. And overall, I would say my research interests focus on older adults and their caregivers, with a special emphasis on Alzheimer's disease and dementia.
Awesome. Thanks, Kanika. So I will go ahead and just jump right in here. So first, I think to have this conversation, we really need to talk about what are some of the current physical health risks of farming. And I know that there's a lot, but if each of you could maybe discuss some of the more prevalent physical risks that you're seeing in farming here in Iowa, and also what's causing them as well.
Well, I'm glad to jump on in. We have a long laundry list of physical hazards that are causing injuries on farms. So we have a lot of our injuries that are sending our farmers to the hospital include falls. We've got transportation. So anytime we're on a tractor, we do have risks. And so about a quarter of our hospital visits are on tractors. And then we also have a bunch of machine and human interaction problems. So that classic PTO shaft We're still getting some hospital trips for those, but we're also getting people caught in other kinds of equipment. So machine guarding and prevention is something that we're also looking out from the safety side of things. When we're looking at health, especially this season right now, we're looking at, dust. Everybody's like, oh, it's just dust. But one of the questions is what is on that dust? And so as we're harvesting, if we've got mold or fungi on our grain, then we do run the risk of developing some acute symptoms that feels like a flu. And if we have that exposure to those microorganisms on dust over a working lifetime, then we could have people developing farmer's lung or farm workers pneumoconiosis. So it's a chronic debilitating condition that now will prevent you from being in those environments in the future. So one precaution, especially with this really dusty season this year, is recommending folks, if you can see dust and you have to remain in an environment where you see that grain dust, just put on that N95. You'll feel better today and you'll feel much better tomorrow if that grain has an issue with it. And then after harvest, we'll start looking at manure gas exposures as we start pumping out our storage units. And we've got some campaigns that our center's working on rolling out for next month.
Mm-hmm.
And I guess while we're in this fall harvest, it's another one that we see is the grain bin, trapped in grain bins, grain entrapment, those types of things. As much as we know about it, we still keep seeing them. There'd be a good one to focus on. Our group is focusing on anyway.
Okay.
Yeah, I would also like to add, of course, my interest is in dementia, which many people think is a mental health issue or a mental illness, but it's not a mental illness. It is a neurological disease, so it is a physical illness. And Emily, since you asked about physical health, we've done some research as part of the Great Plains Center to show that, the odds of developing dementia among individuals who've been exposed to agricultural occupations are much higher than those who are in other occupations. So this is definitely a huge concern for farmers and farm residents. So not only people who are working, but also individuals who might be in the farmstead. And some of the common reasons that others have put forth is very little research on looking at the exact causes, but chronic pesticide exposure has been put forth as one. And others have also talked about exposure to lead deposits when they were growing up. Especially some research from Wisconsin has showed that. Additionally, farmers often work by themselves, so social isolation. It's interesting that even though dementia is not a mental health issue, but mental health problems can lead to dementia, and dementia can lead to mental health concerns. So it's related, as well as sort of midlife hearing loss, which we see a lot among farmers, can contribute to dementia. Others, haven't really put this through, but from what I'm hearing in terms of the kind of people who are coming forth interested in research, in our research, are individuals who've been exposed to traumatic brain injury, working with a lot of livestock, sort of growing up, or, a lot of that in their background. So that could be a potential contributor as well that needs to be sort of looked at. I would also like to echo some of what Renee said, and we've done some work in the center looking at what farmers think their health and safety concerns are, and they're similar to what we actually see in terms of what farmers show up to hospital emergency rooms for. But some of the more recent things we're seeing, and of course, falls is a big one, but also children on the farm are some of those things that are on people's minds right now.
Absolutely. So I think this is a perfect way to segue into my next question. Kanika, you talked about how some of the physical risks that we're seeing can also lead to mental health risks. So David, can you maybe just start us off? What are some of the mental health risks of farming and what is causing them?
Well, right now, what we're seeing is a lot of unease due to the unpredictable nature of farm finances and farm markets. Production costs are just at a record high. That includes fertilizer, pesticides, machinery, and commodity prices for corn and especially soybeans are just not covering these high costs of production. So farm community right now is experiencing a lot of unease. We also see, with farming, just unpredictable nature of farming,
Mhm.
weather conditions, weather disasters, machinery breakdowns, fires, disease, and we already talked about a little bit injury, which is already increases the stress level of farming. And so there's going to be a lot of things that we're going to be looking really closely at this year, certainly because of the farm markets where they are at. But obviously, this can produce a lot of stress and anxiety within the farming community.
Mhm. Absolutely, especially when you're out because of a physical injury. I mean, that's time that you're not in the field working, so that also contributes to that as well.
Yeah, and the physical injury, we talked to the importance of that is because what we see with individual physical injury, if the farmer feels like they cannot contribute to the farm or not contributing as much as they would like, that also there increases their risk of suicide. And so those issues are kind of tied pretty closely together.
Mhm. So David, can you maybe talk a little bit more about just the culture of farming? I know, there's a stigma surrounding mental health. I think, just collectively, there's a stigma still around mental health. But can you maybe talk a little bit more about that, specifically in farming communities and farming families, and how that also affects, their ability to seek help,
Sure.
and maybe just talk about some of the lack of resources that we're seeing too for that.
Farmers are a proud, independent, and self-reliant group. And so they often have difficulty asking for help. And we also see in our rural communities what I call is the goldfish effect. And that means basically, everybody understands what you're doing. And I give the example, I live in a small town in Boone, Iowa. And one day I walked into Fairway and basically someone said, "Hey, you're early." And so in small towns, they not only knew who I was, but they knew our shopping patterns. So that's what I call the goldfish effect. Farm family is not going to park the car next to the mental health center if it's right next to the coffee shop. And so there's a lot of concern about people understanding what they're doing if they're seeking help, and that can be a little bit embarrassing to them. And that's a problem because farmers are at much higher risk for anxiety and depression. The general population also at higher risk for suicide than most occupations. And so that prevents them from seeking care. Now, one of the things that happened during COVID that was huge was the ability to access telehealth. And so I think accessing telehealth for farmers to see mental health care in a more private setting has really been one of the best things that came out of COVID is access to telehealth and be able to seek mental health care wherever they're at.
Mm-hmm.
I'd also like to add, go ahead, Rick.
There's also a competitive side to this too. When farm ground comes up for sale, if the landlord sees your truck or your car outside of the mental health facility, the practitioners, that can have an impact too, that they're a little bit worried about.
Yeah, and with dementia as a concern, even though dementia itself is a physical illness, it can affect other people in the family, caregivers. Dementia caregiving is extremely burdensome from a mental health perspective. I think there are about 11 million caregivers in the US who are providing unpaid care to someone with some form of dementia. And if this is very prevalent in farming communities, then we have a lot of individuals who are agricultural workers or producers themselves providing this care to their parents or to their spouses or siblings. And this can be a concern, partly because something that, both David and Rich talked about, this idea of balancing safety with independence. Farmers are very proud individuals, something they've done their entire life. It's very hard for caregivers to basically say that you cannot do that, much harder than in other places where this would be an easier conversation to sort of have. Also when you combine this with the fact that this is not something which is very easily diagnosed in rural areas, there's a lot of underdiagnosis. So there's nothing to sort of go by, hey, you have this, so you should cut back. There's also other concerns related to the lack of resources and stigma, even if you have the resources to actually access them. And then, farming is not a 9-to-5 job. Sometimes it's a dawn to dusk job. So, managing someone's care responsibilities while you're working on the farm from morning to evening is very hard with no other formal care resources available. So I think those are some mental health concerns associated with some of the physical health issues, but affecting other farmers, if you know what I mean. So.
Yeah, we also, you mentioned the accessibility, and we know in Iowa, Mental Health America basically said that Iowa ranks 45th out of 50 states, and plus the District of Columbia as far as mental health providers per capita, and that's probably not a good place to be. So we're really impacted in our rural areas of Iowa, and many of our rural counties are considered mental health shortage areas. And so just finding a provider that's available and not being on a waiting list could be an issue, because when you really want to seek out services, you don't want to have to go on a waiting list. And I know some of the mental health centers have really worked hard to very creative ways to minimize the waiting lists. We also know that farmers are much more likely to purchase direct insurance from the company or the mental health insurance marketplace. And those plans may not include mental health coverage, and some of them may be expensive. And so that's also a barrier to access mental health care. And certainly the time to travel to appointments, time to be there, a farmer could end up taking a whole afternoon or whole morning just seeking out mental health care. And we know that time is money with farming. And so that's just another barrier to access for mental health care within the rural communities.
Absolutely, especially as, we're smack dab in the middle of harvest season as well. People just don't have the time to not be in the fields.
Yep.
So we've laid out, some of the physical health risks, mental health risks, what's causing them. I'm really interested, and I'm sure our audience is too. What are you all doing in your fields to help address these risks, whether they're physical or they're mental? Like many of you said, the physical and the mental health risks are connected. So just talk a little bit about what you're doing, and maybe give us some specific programs or resources that you offer.
So I'm glad to speak. Nope, Rich has a little delay. Sorry. You want to go first?
You go ahead, Renee.
So part of our center, we have an outreach core. So we develop materials that are target not just farmers, but we develop materials for ag educators so that they can have conversations about hazards and prevention across a whole variety of topics. And so we've got posters. When people go out to a place, they'll send us a photo. Hey, we saw your poster out here. So people are having conversations around some of these materials, which is great. We have training programs that are targeting getting healthcare providers to understand what are the risks on the farm, what do these farming terms mean, so they can have a better conversation with a farmer, while overlaying with that some of the health and safety hazards that they can have conversations with, right? And so we've got an 8-hour Audible class with some diagrams and pictures and fun handouts to get them to remember stuff. And then we've got hour-long sessions so people can get certified and maintenance points and all kinds of ways to get some credentials in this area. And then we have a lot of one-on-one going out to farm shows. We've got a team that spends a lot of time with youth, so young farmers and folks in community college and college, to get them to start adopting some of these personal protective equipment practices and pointing out, if you look at your elders, right, you're starting to see this loss of hearing. Well, if you take precautions now, you can prevent that from happening, which is not just helping health, but also hopefully long-term mental health, because we know that as people lose their hearing as they get older, they don't communicate as much because it gets really frustrating. Then they start to get withdrawn. And then we're now into David Brown's bucket of needing some additional assistance for coping and mental strengthening that's needed. So those are some of the things. And then we develop a lot of materials that I know Rich then passes on to his ICASH crew.
Yes, and that's good. Well, that's really kind of what we do. I guess our team is blessed in that I get to work with all four of these, or all three of these wonderful people that are on the panel today. One in particular, and I don't want to steal all of David's thunder, but one that we're very thrilled about is one called Relationships Can Heal, which we're working with the mental health practitioners in the state to understand the culture of farming. That sometimes dealing with the agricultural population isn't the same as dealing with our inner city cousins. And it's been a wonderful project to work on. I'll let David talk more about that because he was behind, the brains behind this one. So Tim and I, the other presenter, are just the presenters. So,
well, thanks, Rich. Yeah, we've had just a great time teaching mental health and healthcare professionals all about farming, and I couldn't do it without Rich and our other presenter because they're our farm experts, and so. It's great to have that background to really get a sense of what farming is all about to these mental health providers. And maybe haven't experienced that, don't know to ask how to good questions, don't know how to, or even maybe ask the wrong questions. You're not going to tell a farmer during harvest, well, you need to take 2 weeks off right now because you're too stressed. That's just not going to happen. So you have to have that little kind of underlying knowledge about farming so you can ask good questions and build that relationship. So that you can actually get into the issues that may be impacting the farmer. Mm-hmm. One of the things I do want to talk about, we also provide a hotline called Iowa Concern Hotline, which is ISU Extension Outreaches. Basically, we provide confidential access to stress counselors and attorneys for legal education, as also information referral service for a variety of different issues. It's available 24 hours a day, 7 days a week. You can access to 1-800-447-1985. And so that was one of our key resources to the rural communities in Iowa. We have available resources 24 hours a day, 7 days a week. We also do a lot of training with farmers and farm advocates, helping to build a community of individuals willing to help each other. Basically, we want to teach people to look at the signs and symptoms of mental health and substance use issues, and then know how to intervene and engage, and then point them to the right direction to the appropriate mental health provider. And so we've, over the past 6 years, we've trained about 3,000 individuals across the state of Iowa to make sure that they are better prepared to help each other and point them the right direction to mental health professionals.
Yeah, the Great Plains Center has a pilot grant, and one of our pilot grant awardees this past year is Iowa Farmers Union. And so David is actually giving training to the farmers that are in his study so that farmers really develop that catalog of skills of having communications and how do you have that conversation, because it's not easy to have a tough conversation when somebody is not doing well, but you don't want to make the wrong move and call the wrong person to come in, because then things will snowball. So really getting people to know how to have that conversation is so critical, so that it just kind of becomes natural and not fearful of having that conversation. I remember well before COVID, we got contacted by a crisis hotline in Iowa, and they're like, all of our volunteers are in the city, but we're getting all these calls from farmers. It's like, okay, well, you guys need to understand why they're stressed and what that means. And so we've done surveys of not just what farmers need for health and safety, but what is stressing them out. And it's always money, weather, relationships, and that varies by age, and then we get into some other things, but we knew that every year we're worried about the weather because we know that's going to be a stressor, but this year the economy is kind of turned upside down, and so we're kind of braced for this. And I think the more people that are listening to this session that can say, oh, I can have that conversation because I'm not alone in this issue. I mean, all farmers right now are struggling with this because of the lack of market. And so it's like, yeah, I know you're proud but you're not alone in this. So do talk to your neighbor and just say, hey, I feel you. And that will, just those simple connections will get people to start talking.
Mhm.
And there are a lot of resources out there for people to be able to do that. The one that pops into my mind is mental health first aid. A lot of us are trained in first aid for physical injuries. Well, here's an opportunity to become trained in mental health issues as well. I know, David, you know more about that than I do, but I've taken the course. But
yeah, we're fortunate to be able to have some funding from the USDA to offer mental health first aid. It's an 8-hour class, but really prepares the individuals to be better able to respond to those mental health and substance use challenges. It could be family members, friends, coworkers, other farmers. But I think it's been an important class for us to offer to agribusinesses, of course, across the state. We're working with farmers, can also assist farmers that way as well.
And Kanika, do you want to talk more about your dementia research?
Yeah, sure. So we've developed a program called Farm Families Coping with Dementia. It's an interactive workshop to support family members, in the agricultural community who may be caring for another person who has diagnosed or suspected dementia or some level of cognitive impairment that they have been noticing. And essentially, this is a 4-week training session. Each session is 1 hour long and sort of focuses on different topics. So the first session really focuses on dementia basics, understanding what it is, what are the different kinds of dementia, what treatment options there are currently in this high prevalence in ag occupations. The second session is really looking at how some of the symptoms of dementia, which many people think is a memory disorder, but it's much more than a memory disorder. In fact, some of the first signs of dementia are associated with vision changes or communication problems, and how these concerns really change to safety issues on the farm. And this is something, Rich has been extremely helpful to us here. We've actually been to farms and, filmed and taken pictures of many of some of these safety concerns and what might happen, if someone has dementia and is working on the farm. So that's the second one. The third one is sort of talking to caregivers about how to approach these safety issues, because as we just talked about, it's not going to work if we look at some of the traditional approaches and tell the farmer that no, you cannot do this. That's just not going to work. So how do we get away from this all or nothing approach to more of an incremental approach, to safety, and how can we do some things depending upon the stage of dementia and depending upon what their daily activities are. So customized sort of safety experience on the farm when someone is working with dementia. And then the final session focuses on caregiving and communication, and really tries to talk about some of the caregiving burden, the ideas of stress that comes with caregiving, when to talk to a provider, and also communicating with other people in the family. A lot of things that we've heard is once someone has dementia, whether diagnosed or not, it does not go beyond the family. It's just this issue of privacy. But here, employees might need to know, or others might need to know. So this, why is communication important? How to communicate with the person's physician and their care team, as well as others in the family, how to prioritize who to talk to first, and then communicating with the person with dementia. So not only is some of the caregivers that are part of this training, who've lent their voice to this training, have talked to us about how farmers are poor communicators. I don't want to generalize it, but they talked about their family experience. They're just sort of poor communicators in general with regard to family issues, but this makes it worse. So how do you really communicate when you have these symptoms, making communication that's already problematic worse? So how do you communicate with the farmers? So there are these 4 sessions. We have an upcoming training on October 13th. If you're interested, feel free to contact me. It's a free training. It's online. And it's delivered by Illinois State Extension, which is another group who has collaborated in the development of this training. And this training was funded through the CDC NIOSH, as part of the Great Plains Center. So that's basically what we're doing for farm families who might be coping with dementia. Really trying to bring this issue that is very under the surface as far as this subgroup of the rural population is concerned.
Thank you, Kanika. So as we've talked about some of the resources and the programs and the things that you're doing in your current roles, I'm interested, what are some of the challenges that you're seeing in addressing these physical and mental health risks? What does that look like? Do you receive a lot of pushback? Are people receptive? Is it kind of a mix of both? What does that look like?
I can speak for ours. It's a bit of both. We do get welcome, when we're on farms, when we're at farm shows or wherever we're at, we do have a lot of people come up and want to talk to us.
Mhm.
We also see some pushback or the common thing is, yeah, that'll work great. I'll let my grandkids know about that, instead of, seeing it as that first person that really needs to show them, the right way to do a lot of the things that we're doing. So it's been very, very eye opening for me. And as somebody that's been involved in agriculture for a long, long time, it's been a lot of fun trying to overcome some of those obstacles. So.
Mhm.
In our case, it might not be very farm centric or agriculture centric, but when we ran these sessions, one of the issues that we faced was participants dropping off, partly because, they talked to their spouse about it, and the spouse refused to believe that they have dementia. But the other spouse who's interested in taking the training feels that there might be an issue or might be a need to be better prepared just because of dementia in the family. So there's a lot of, we didn't want to do this as part of our training, but a kind of, arguments at home in terms of whether it's okay to be a part of this training or not, because the other person feels there's nothing to worry about. It's the same culture of, not wanting to talk about this. That's sort of coming up as well. The other thing that we heard when we were developing the training is the need to make this training online, and make it, and was part of the reason is someone who's caring for another person with dementia cannot leave the home, and I think it's just hard to sort of do that. So it's important to have an online training to sort of allow that, facilitate that, and also of course the access and so on. We've had no trouble in terms of broadband connection and people reaching out. That has been okay.
Renee, David, do you have anything
Yeah,
to add
when
to that?
just coming from the University of Iowa, they're like, "Oh, you guys don't know farming." So we do run into that quite a bit. It's like, well, but we do. So getting into farms to help do hands-on stuff is, it's hard. It's hard to get trust of a farmer. We have done a lot of work in hog barns, and so once we get the porcine virus breaks out, nobody wants anybody to come on anybody's farm, because there's economic implications if there's an outbreak, which we totally understand. But our work is to try and clean the air so the outbreak is minimized in the farm. So it's like we really have this great solution, and everybody, thinks it's a great solution, but we still have to prove that it works and design things. So, getting access in to help answer questions that we know farmers have asked us to help them answer is always tricky. We've got great partners in the academic realm, however, so we've been able to get into not necessarily modern production buildings. Some of them tend to be a little bit older, but we get into do work at community college. I mean, I dragged Rich back in the day into some swine barns just to help get data, because I don't want to come up with a solution that's going to cost a farmer money unless it's going to do what it delivers. And so whenever any of us in our center do any work, it's like, what is the outcome and what is the cost? And so every time we publish something, what is the cost that you are asking a farmer to do? So we're really, what is the per hog cost of implementing this air pollution control to improve not just hog health, but worker health in a building? So really being sensitive to these economic drivers that are probably more in front of a farmer's mind versus necessarily health when we're talking about their work as a business. So we do have to approach it from a One Health perspective to say this will help your animals, it'll help your productivity,
Mhm.
and it will help you feel better and be able to have this farm for a long period of time.
Yeah, I think piggybacking on what Renee said, a lot of what we do, trainings that we develop at the university, they need to be tested. We can't sort of have this out there for, open before it's really tested and shows that it's effective on certain measures. When we because we have to sort of present this as a research project, sometimes there's pushback, in terms of being part of some of these projects. But we have to, be clear about what it is that we're doing, even though it's a resource that we are providing, but it is still in testing phase. So we have to call it a research project. And so I think really thinking through how we can use those words a little bit carefully to really show, it's not like we're looking for guinea pigs, but, we're really trying to do a program that might support people in the future and you right now.
Yeah, I think the biggest challenge for us has been how to get that mental health information, mental health stress assistance information in front of the farmer. I've been able to, how do I want to say, get myself snuck into programs that were directed towards the farmer. And sometimes that it goes over very well, and then sometimes it does not. We actually had a project that was funded by the Great Plains Center back in 2019 that we were able to provide a suicide prevention program as a part of a farm bill program right before COVID. And we were able to get in front of about 4,000 farmers to talk about suicide prevention. Our evaluations were kind of polarizing. Some loved it, some were not thrilled with it at all. And so, it depends on the time and the place. But you get mixed reactions when you try to get that type of information from the farmer. Now, what's really interesting, a year later, after COVID started, we started getting all this positive feedback saying, "Thank you for giving that information to us right before COVID." I mean, the timing was ironically pretty good. But so we've actually probably had more success working with individuals who are actually working with farmers, co-ops, commodity associations, things like that, who are serving the farmers. So at least they are prepared to help the farmers as well. And that seemed to be an easier audience to get access to.
Yeah, we do work with a lot of what we say is intermediaries, those people that service directly to farmers, and will go to the Iowa Co-op Directors meeting, right? And those folks want some safety information that can easily pass directly on. So we've developed, here's some, put these by your earplug so people know how to put them in, right? And so give them some things that they can immediately fit into their business model, whoever they are, be it a healthcare provider, a retail location, and really make it easy that when people are face to face with some equipment that they may want to get, that they've got a way to answer that question or ask for more information. And I think, it's a lot of feet on the ground to do that. But I think those are our biggest success factors is really getting information to people that want to make a difference. We did some training on gas monitors at one of the MRASH meetings and ended up with one of the co-op directors saying, I've been giving people, a bunch of nonsense at Christmas time. I'm going to give them this $100 monitor. I'm like, thank you. You may have just saved a life or many lives just by getting people to understand these very inexpensive things exist. And it's the only way you can tell if there's hydrogen sulfide in your manure pit without inhaling it and stopping breathing. So thank you.
But I think that highlights one of the other challenges that we have, and that's getting the right information, the right material. And Renee talked before about N95s with this dust. What's the proper respirator to wear in certain situations? And I know if you go to, a lot of times we'll go to the local, farm stores, they'll have the material, but they might not exactly know how to use it or which is the right one to use, and try and working with those groups and the co-op groups and some of the private retailer groups has been working fairly well.
Absolutely. So education is absolutely key to making sure that farmers are doing what they're supposed to be doing to
that they know that there is a hazard first. I mean,
well, yes.
They're so focused on, getting a job done that, I think sometimes safety does move down the priority list, and I get it. I understand it. So, getting to get information to know, oh yeah, that's something I should think about before I do this. And then if I need to do this, what do I do? Right. And having those resources matched up for folks that when they see something, they remember, oh yeah, I'm supposed to do something. What is it again that I need to do? Right. Yeah.
Absolutely. So I wanted to look at the big picture here now that we've talked about all of this. So what happens to farmers, their families, their communities, and just the overall state of ag in Iowa and beyond if we don't address these issues or if we don't take them seriously? Like, what are some of are there like bigger consequences that we could see from that? What does that look like?
I know right now with the financial conditions that farmers are experiencing, I'm really, really nervous about the suicide rate increasing for farmers, which is already high. And suicides in rural farm communities really has this very large ripple effect, not only for the immediate extended families, but the communities as well. And so, because we know one of the things that farming is so tied to their farmers are so tied to their identity as a farming, and if they start the financial conditions start impacting that identity, that I'm really nervous about the suicide rates increasing, and that's my key concern right now.
There's not a really good study on this, but anecdotally, I think the common story is if there is a fatal injury on the farm, which would also be a suicide, then there's a 70% of farms are going to go out of business within 5 years. So that I think is important information to convey to somebody that is really struggling, right? It's like your family is going to lose the farm if we don't stick around and figure this out. So, but that's, for mental health issues. But if I get caught in a grain bin, right, I'm leaving my wife to handle a bunch of stuff. How is my property going to go on? So I think focusing on health and safety as important to the survivability of my farm, I don't think we've really spent a lot of time on. But I think it's another way to think about, if we do this thing safer, we'll have this farm, we'll be around to enjoy it and keep it so that our kids can farm if that's what they choose to do. And so I think that's a kind of healthy way to think about injury prevention and taking care of ourselves, because people do want to have that farm in their family and get that century farm status.
Yeah, I think in terms of dementia, of course, if it's not addressed in some ways, we are at risk for more serious injuries on the farm, as well as more mental health concerns that go unaddressed for our caregivers. But talking about severity of injuries, we just recently did a study where we compared injuries with dementia and agricultural injuries with people who just have dementia and injuries, basically individuals who show up to trauma center. So they all have injuries, and if you look at people who have agricultural injuries and dementia and compare to individuals who just have injuries with dementia, we see that the first group is much more severe, much more diverse causes of injury. So these people are continuing to work. They're having injuries that are taking them to the ED for that's emergency department for more for more severe. The prognosis is much more worse as well, because they're coming in and being hospitalized for ICU or surgical care relative to others who have just dementia and don't have this ag aspect. So definitely this sort of first evidence showing that this combination is almost like a double whammy for farmers who are already at risk of injuries and fatalities, especially older farmers, and they continue to work. Nearly 40% of the agricultural workforce is 65 years or older.
Thank you, Kanika. So I want to leave our audience. We're about 15 minutes from time, but I'm really interested in all of you sharing what some of the positive outcomes and stories are that you're hearing within your outreach and your research and the programs that you're implementing throughout Iowa.
For us, it's the thanks. We'll get a lot of letters and a lot of phone calls and just people coming up to us thanking us for what we're doing. That to me is the win. That's what we like to do, making sure that we're getting the right message to the right place. And I think we are. Are we going to reach everybody? Probably not. At least not today. We still have some work to do, which I think is a good thing, but that'll keep us going over the long haul. And when you hear somebody come up and say, "Hey, thank you for doing that," or "Hey, I showed Grandpa," somebody that's been through a respirator class or through fit test, and I showed Grandpa, now he's wearing his. That's a big win. That hardly, I see Renee, that hardly ever happens, but it has happened. I've also said, "Hey, you're going to take this home and show Grandpa," and they're like, "Hell no," he's not going to listen to me. But so if we can slowly start to make inroads, and to me, it's interesting how sometimes misunderstood this is. I remember working with Kanika when she was developing this product, going and looking at combines, and that's the one that sticks out in particular, Kanika, is when we were talking to the combine dealer guy, and we said, "Hey, the steps should be the same color because," and really talk about that. These caregivers, especially with folks with dementia, are. We call them training seats and combines, not buddy seats. They're supposed to be there for training, but they have nobody else to watch. The person, so they're bringing them up into the combines and things with them. And to me, it was really fascinating to hear that and to take another alternative look at the way that we see things.
Mm-hmm. Yeah, I just want to talk a little bit about the Iowa Concern Hotline. Iowa Concern Hotline last year answered over 11,000 calls, and that's a lot of calls. Mm-hmm. But there's one call in particular that was shared with me. There was a farmer that was really, really struggling, and he was having some problems sleeping, and he was up in the middle of the night. Didn't want to call his family or friends or anybody. Didn't want to wake anybody up, maybe out of embarrassment or whatever. And so he called Iowa Concern Hotline and started chatting with folks there. They hooked up with some appropriate resources, some resource referral. And the farmer is still with us and is real thankful that the Iowa Concern Hotline was available 24 hours a day, 7 days a week. Because sometimes, you may not want to talk to family or friends, but it's always available, always anonymous. And he actually went to his refrigerator, had a refrigerator magnet on the refrigerator, and that's where he found the number and he called. And so I just want to say that sometimes that's a great resources, and that's available 24 hours a day, 7 days a week.
Yeah, with our training, individuals have reached out in our evaluations and have said that they've gained sort of many ideas for safety issues and where to get support. They're able to better identify safety concerns and are able to understand the importance of why you need to take time to analyze something that the farmer has been doing throughout their life may actually be risky now, and what are the actual steps involved in the entire activity to see where dementia can play a role. So they're able to sort of see the importance of doing that, and I think a lot of them also expressed emotional validation of not feeling alone. Which I think is a big deal, and as we have just talked about, and they've talked about actions like they would want to share the diagnosis with others or want to research what is available in terms of assistance in the community, with sort of not farming related resources, but aging related resources and other resources that might go beyond just sort of the typical ag centered resources that we have. So those are some of the things that we're hearing, and they're also sort of hearing more about doing better on sort of the tests that we have about their knowledge on dementia, so they know better about what the disease is and how it can affect them.
Mm-hmm.
Yeah, and I want to give a shout out to, having federal funding to do the kinds of work that we do, because farmers, they've got some USDA support, but they're really the only support that is for worker safety and health for farmers is through this NIOSH funding.
Mhm.
And so, the centers were started back in 1990, but we have identified, farmers, low back pain. And as you get older, like, what is the cause of it? And so, because farmers were talking about it and then asking, when do I change the seat on my tractor? Nobody has any information on that. So we managed to get a study funded, and it's in the middle of research right now to figure out how can we develop a tool that anybody could put on their farm, low cost instrumentation, so we can answer that question. So there are a lot of really good questions that, if they're health related, we still have a little bit of source funds. It's not big, but it's enough to figure out what it is that we need to figure out. We have had, over the 10 plus years I've been at the center, people call and ask about their older family member. And so we started putting these threads together, and Kanika's like, oh, that's my area. So we've been able to find people to help answer questions that farmers have. So we are always interested in what questions about my health and safety, that if we don't have an answer to it, we got people that we can come up and do a study, as long as people will participate, and help you get an answer to a question that's going to address the problem, that's going to prevent you or future generations, your children, from having an adverse outcome, and doing it in the most cost-effective way, because we know that's important to get something adopted. Because we do have federal funds to do it, we can't charge you an arm and a leg when we come out the other side of things. And so that's something that we pass through and give out to our community. So that's what keeps our center going. That's what keeps me excited, is being able to come up with these projects to really answer questions that are relevant to the people listening today.
Absolutely. So it does not look like we have any audience questions, but I did just want to ask everyone, this has been an incredible conversation. You've all been wonderful. Is there anything you'd like to leave our audience with before we end the session?
I know one thing I always share is I just want to share the importance of people being willing to engage other people if you're worried about them. So many times I hear the stories, I was so worried about this individual, but I didn't do anything about it. And then you hear a bad story after that. So I guess I just want to challenge people to feel free to engage other people, check in on them, see how they're doing, know what resources are available out there, so that you can really help each other. And I think we're Iowans, we're really good at that. So that would be my like to get people get across is learn more about how to help each other and point them in the right direction.
That's great, David.
And if you need help, ask. Ask any of the four of us that are in this group. Ask friends and family. We're all here. We're all more than willing to help. And if we don't know the answer, we'll sure work to find the right one and find who you need to be talking to. So
that's great.
Yeah, I would add to that, some similar themes that we've been talking about. You're not alone. And somebody will have an answer. So, a lot of your friends and family members or neighbors across the street, they want to help you. And I think that's important to sort of know that. And someone somewhere has faced what you're facing, either in a similar way or, in a very close enough way that they can help you. So being open to that and knowing that you're not alone it's hard to sort of know, but it's important to to the extent that, this message gets across is important.
Absolutely.
Yeah, and I think as we're in harvest, in the throes of things right now, we will get through the harvest. We will have crops. We will figure out what to do with them. We will come up with solutions. Trust the process. But as we're spending long days and many hours at a time, just check in with one another, right? We all have mobile phones. Little steps right now. Check in with everybody. Everything okay? You need anything? Take a break. The longer that you're in a tractor, the more your attention kind of goes elsewhere. So in some years, we've had a bunch of FFA kids go and help dad take a break on the tractor during harvest. So if they're not out there, consider that your challenge. I think take a second, think about what are the risks of what you're doing. And if there's a bad outcome, if we need to call emergency response, if we've got to get a hold of somebody, right? 5 seconds of thinking through what we need to do before we start our day reduces the chance that we'll have to do anything through that day. It's a really easy way of saying, I am safe and I know what to do. I'll be calm when something happens. And have a great harvest, everyone.
Well, with that, I will go ahead and end the session. Thank you all so much for joining us today. We will have another discussion in the agriculture track with biosecurity and food production at 3 o'clock tomorrow. Thanks again to our Iowa Ideas presenting sponsor, ITC, and thank you so much, Renee, David, Kanika, and Rich for a lively and very informative discussion. Thank you all so much, and I hope you have a great day.
Thank
Thanks,
you.
Emily.
Yeah, thanks, Emily.